Systemic lupus erythematosus, abbreviated as SLE. This is a systemic disease, which means that it can affect the whole body systemically. The brain, skin, heart, lungs, kidneys, joints, the immune system, the vascular system, and the list goes on. Lupus means wolf, and erythematosus means reddening of the skin. Why did I show a red butterfly? Because a very typical sign of SLE is a butterfly-shaped reddening of the skin. And the way I remember this disease is to imagine a wolf that attacks a woman. And why a woman? Because 9 out of 10 patients are women. So the wolf bites the face of the woman, causing a butterfly-shaped erythema on her face. And then the wolf continues to bite all her organs one by one. Because this disease is a systemic disease, which means that it can affect all the organs systematically. Of course, this disease has nothing to do with the wolf, but SLE is an autoimmune disease, which means that this woman called Emma have an immune system that attacks her own body instead of only attacking bacteria as it should do. So Emma have an immune system that acts as a wolf inside her. And I will show you how we can find out if Emma really has SLE by diagnosing her, and then we will look at what type of medications we can give her. I want you to remember at least one thing from this presentation, and that is Systemic Lupus International Collaborating Clinics, abbreviated as SLICC. SLICC is a criterion that can help in the diagnosis of SLE. SLICC contains clinical criteria, immunologic criteria, and biopsy criteria. And we need more than 4 criteria with at least 1 clinical and 1 immunologic. Or we need 1 biopsy criteria and 1 immunologic criteria. So what does these 3 words mean? Clinical, immunologic, and biopsy. The synonym for clinic is hospital. So clinical criteria stand for the symptoms, signs, and lab values of a patient in the hospital. Immunology deals with the immune system that protects you from bacteria, viruses, and parasites. So immunologic criteria are usually lab tests that detect any problem with the immune system. Biopsy means that the doctor cuts out a piece of an organ. For example, a small piece of kidney can be cut out. And then the doctor puts this piece of kidney in a microscope and looks for diseases. Clinical criteria can be divided into alopecia, which means hair loss, skin problems, ulcers, heart diseases, lung diseases, kidney problems, joint pain, problems with the nervous system, and blood diseases. We have skin problems, grouping them under the name Cutaneous Lupus Erythematosus. We can divide these skin diseases into acute, into subacute, and chronic, based on the timing of the diseases. Acute diseases are usually those that happen suddenly with a short duration. Chronic diseases are ongoing for a long time, whereas subacute means those diseases that are not yet chronic, but has passed the acute phase. And the way to remember these timings are to memorize 2 numbers, 1 and 3. Why? Because the duration of acute diseases are usually less than 1 month, subacute are 1 to 3 months, and the chronic are more than 3 months in duration. So which are the acute type of skin problems? We have butterfly erythema, which is a reddening of the face in a butterfly shape. It usually affects the cheeks, or also called malar region, and therefore it is sometimes called malar erythema. And it does not affect this nasolabial region. There can also be bullous lesions, which are blisters that can be a mix of small grouped vesicles to large tense bullae. And bullae are elevating the skin and are filled with fluid. Toxic epidermal necrolysis, like SLE, is a detachment of the epidermis, the upper layer of the skin, resulting in exfoliation, meaning that the upper layer just falls off. And this is very dangerous because the skin is the organ that protects against infections. So if you lose a large part of your skin, then sepsis can happen, which means that bacteria easily invade your vascular system since there's no skin to protect you. And this can lead to something called septic shock, which can lead to death. Maculopapular rash is another acute sign. Macules are flat spots up to 1 centimeter, and papules are bumps up to 1 centimeter. So maculopapular is a combination between macules and papules. Photosensitivity can also be seen, which means that the skin is much more sensitive to sunlight than normally. And this can cause solar urticaria, which is a vascular reaction of the skin that causes patches. Patches are flat lesions like macules, but they are bigger than 1 centimeter. So one difference between macules and patches is the size. And macules are less than 1 centimeter, whereas the patches are more than 1 centimeter. So the acute cutaneous lupus erythematosus can be divided into 5 lesions: butterfly-shaped erythema, bullous lesions, toxic epidermal necrolysis with maculopapular rashes, and photosensitive solar urticarias. The subacute cutaneous lupus erythematosus can be divided into 2 types. One is the annular polycyclic lesions, and the word polycyclic refers to more than one ring structure that can be seen in chemistry, for example, and the word annular also refers to a ring-shaped structure. So annular polycyclic lesions are ring-shaped skin lesions that usually occur on sun-exposed areas of the skin. This is a non-indurated psoriaform. It's another type of subacute skin lesion. The psoriaform means that it looks like psoriasis, and the non-indurated means that it is not hard, whereas psoriasis is usually hard. Subacute can be divided into annular polycyclic and non-indurated psoriaform lesions. If we go on with the chronic skin lesions, we have Chilblain lupus that affects the toes, the fingers, the nose, the ears during cold weather. And these are painful, bright red nodules. And nodules means a swelling of the skin that is up to 1 centimeter in diameter. Discoid refers to the disc shape of these lesions. And we can divide discoid into classical type. We can also divide them into localized, which means that discoid lesions appear above the neck, and generalized, which means that discoid lesions can appear both above and below the neck. The Lichen planus is an inflammatory disease that can affect the skin and oral mucosa, and here we see a picture of whitish Lichen planus on the oral mucosa, and the word lichen means tree moss, as you can see here on the picture. So this disease is looking like a tree moss, but with a whitish color. And in SLE patients, this happens that a discoid lesion is seen together with Lichen planus. The verrucous lesions, or also called hypertrophic lesions, are skin that hypertrophies, which means that the skin cells increase in number and cause these hard wart-like lesions, especially on the extensor arms. Mucosal lesions can affect the mucosal membrane around the teeth, the tongue, and heart palate, for example. Panniculitis, or also called Profundus, is an inflammation and destruction of the subcutaneous fat. Tumidus lesions are pinkish urticarial non-scarring plaques, usually in the sun-exposed areas. Plaques are elevations of the skin, similar to papule, but they differ in size. So plaques are more than 1 centimeter in diameter, whereas papules are less than 1 centimeter. The chronic skin lesions are, in conclusion, Chilblain, discoid, discoid with Lichen planus, hypertrophic, mucosal, panniculitis, and Tumidus. Now let's see, we have ulcers. Ulcers can appear on the mucosal membrane, on, for example, the heart palate, as we said, the buccal region, on the tongue, and on the nasal septum. Inflammation can affect the heart, causing pericarditis. And here we see a normal heart on the upper picture and a reddish heart on the lower picture. Inflammation is causing this redness, it's causing pain, heat, swelling, and loss of function. And the heart wall, will rub against each other, causing a typical pericardial rub sound that one can hear with the stethoscope. And here we see a man having a painful pericarditis. And a pericardial effusion can also happen, which means that fluid accumulates around the heart, causing a typical water bottle shaped heart on the X-ray. Here we see the heart with a water bottle shape, and as I mentioned, this pericardial rub sound can be heard with the stethoscope. So listen carefully. It almost sounds like you are walking on snow. This is a typical friction rub. If we continue with the lungs, so inflammation can also affect the lungs. So similar to the heart, there will be inflammation, pain, pleural friction rub sounds, and pleural effusion. And here we can see the pleural effusion that have accumulated between the two layers of the lungs. And this is how pleural friction rub sounds like. So imagine walking on snow now when you hear this sound. And we need to collect urine to find kidney problems. And more than 500 milligrams of protein in the urine during a 24-hour period can be seen in SLE patients. And this is called proteinuria, meaning protein in the urine, which is not normal. And we can also find red blood cell casts in the urine by analyzing the urine in a microscope. And these casts are formed by red blood cells that stick together. And blood in the urine is not normal, as we said, and this suggests that something is wrong with the kidney. Synovitis is inflammation of the synovial membrane of the joints. Polyarthritis can be seen in SLE. Poly stands for that more than one joint is affected. And arthritis is inflammation of the joint. So more than one joint will be inflamed, causing pain. This is what you have to remember about the joint pain. The nervous system can also be affected by SLE, and seizures can happen, which are hyperexcitation of neurons in the brain, sometimes leading to muscle contractions. And psychosis and acute confusional state, also called delirium, can happen. Psychosis and delirium patients usually suffer from hallucinations. Neuropathies can be seen in SLE. Neuropathy means that the neurons are diseased. And the neurons can be in the cranial part, in the peripheral part, in the spinal cord, which is then called myelitis, or single nerves can be damaged, which is then called mononeuropathy, mono standing for single, or multiple single nerves in different areas of the body can be damaged, which is then called multiple mononeuropathy. What can we see in the blood? With the microscope we can distinguish different blood cells. And here's a picture showing the blood cells. The blood cells originate from one cell called multipotential hematopoietic stem cells. And this cell can produce myeloid cells and lymphoid cells. And the myeloid cells can produce erythrocytes, also called red blood cells. But in SLE, hemolytic anemia can be seen, which means that the erythrocytes can be damaged and therefore anemia will happen, which means that not enough oxygen is transported to the tissues. The myeloid cells can also produce megakaryocytes that can further produce thrombocytes, also called platelets. But in SLE, the number of thrombocytes can be reduced. And then we call this thrombocytopenia. Penia stands for less of something. In this case, we have apenia of thrombocytes. So thrombocytopenia. And the symptom of thrombocytopenia is usually petechiae, which are small purplish spots on the skin. Leukopenia can happen in SLE, which is a reduced number of leukocytes, which are white blood cells, with neutrophils being the most common white blood cell, and lymphopenia can also be seen, which are a reduced number of lymphocytes. So, the clinical criteria were alopecia, skin lesions, ulcers, diseases of the heart, the lung, the kidneys, the joints, the nervous system, and the blood. Now if we go on with something else, we have the immunologic criteria. This is related to the autoantibodies, meaning that the antibodies of the immune system attacks itself instead of only attacking bacteria. And here we have a cell with its nucleus containing chromosomes that contain DNA. In SLE, the antibodies attack your own nuclear proteins, for example, your own DNA or RNA binding proteins called Smith protein. So in SLE, we check for antinuclear antibody levels, abbreviated as ANA, and we also check anti-Smith and anti-double-stranded DNA. Another immunologic criteria is direct Coombs test, and here we mix the patient's blood together with the Coombs reagent. And if red blood cells agglutinate, meaning they stick together, then we have a positive test result. The complement system helps or complements the antibodies to fight infections, and in SLE we can see a low number of these complement proteins, and the complement proteins are numbered C1 to C9. And it is the C3 and C4 complement proteins that are low in SLE, and the CH50 stands for the total complement activity, which is also low in SLE. An increased number of antiphospholipid antibodies can be measured in SLE, and these antibodies bind to proteins like beta to glycoprotein 1 on the phospholipid cell membrane. And the function of the beta to glycoprotein 1 is to prevent phospholipid membrane to activate thrombosis cascade. So we know that thrombosis can cause death, so therefore it is very, very important to check the antiphospholipid antibody level. And it is especially important in pregnant women because these antibodies can cause spontaneous abortion and late fetal death. Except antiphospholipid antibodies, the SLE flares can also cause fetal death. SLE fluctuate between flares and remissions. A flare is a very active disease with many symptoms, whereas a remission is an inactive state with few symptoms. And during pregnancy, the mother should be monitored for any SLE flare, since these can lead to fetal death, as we said. So if a woman wants a child, then pregnancy should be timed for when SLE is in remission for at least 6 months. And furthermore, there are some antibodies called anti-RO, so anti-RO. And these should be measured, because if anti-RO is detected, then doctors should warn mothers that there are risks of the fetus getting something called neonatal lupus, or even a severe congenital heart block, which means that death of the fetus can happen. So, it is very important to monitor the fetal heart, in this case, with, for example, an echocardiograph and a 24-hour Holter monitor. Now we turn to biopsy. So here we need a biopsy of the kidney, which will show that there's inflammation, called nephritis. But it is not enough with a biopsy. We need an immunologic criteria as well. For example, the anti-nuclear antibodies or anti-double-stranded DNA. So we need a biopsy and an immunologic criteria to say that, yeah, this is SLE. Let's see how we can treat SLE patients. The first thing that we have to do is to remove any type of medication that can cause SLE-like symptoms. And these are, for example, hydralazine, procainamide, and isoniazid. So we start with these. Remove any type of drug that can cause SLE-like symptoms. And these three are those. Non-steroidal anti-inflammatory drugs are also very useful in SLE patients, especially in controlling arthralgias, which means painful joints. And here we can see naproxen, ibuprofen, and diclofenac. The anti-malaria medications also help joint problems, but also skin problems, and they reduce the SLE flares. And the typical SLE medication is hydroxychloroquine, but there are alternatives like chloroquine and quinaquine. And the hydroxychloroquine can, in rare cases, cause retinal problems, skeletal muscle problems also, and cardiac problems. So it is very important, especially that the eyes are examined yearly. So every year, check the eyes. Corticosteroids are usually the first line treatment in acute severe SLE, and we typically begin by giving an intravenous methylprednisolone for 3 days, and then we maintain the therapy with prednisone. Disease-modifying anti-rheumatic drugs are also very important. We can use azathioprine, methotrexate, mycophenolate, mofetil. We have cyclophosphamide together with mesna. And in very severe cases, we have intravenous immunoglobulins. And it is well known that corticosteroids used for a long time can cause osteoporosis, which means bone weakening. Therefore, it is important to consider giving calcium, vitamin D, and bisphosphonate. So, to conclude, we can say that Emma has SLE, which is a systemic autoimmune disease that affects her whole body systemically. The brain, skin, heart, lungs, kidneys, joints, the immune system, and the vascular system are all affected. Lupus means wolf, erythematosus means reddening of the skin, and the typical butterfly-shaped erythema can be seen in SLE patients. And I thank you very much for listening.